make diagnostic tests. For decades, clinical labs have had the freedom to develop diagnostic tests. We have thousands of clinical labs. They have a rigorous certification process. Many of them are leading universities. Some of the smartest researchers in our country are in these clinical labs. When
Senator Paul, can you identify the amendment that you're calling?
So it's Paul Amendment number 3, and this ensures that the clinical labs will still have the freedom to innovate. The bill in front of us takes that power away from clinical labs and says they have to go to the FDA first. You may recall the debacle when the CDC and the FDA were in charge during the pandemic. They monopolized the lab test, and they prevented the clinical labs, the universities, from being laboratories of experiment and from this great innovation by having a dispersion of power across all of our universities, utilizing very, very smart people in virology and pathology and all these basic sciences. Instead, we said, oh, you got to go to the FDA. And what did the FDA do? The FDA stymied this, and they said, oh, no, only the CDC gets to do a test. And what happened? The test didn't work. So we were a month into the testing for this pandemic, and many of our researchers in our clinical labs had already developed the testing. This bill now changes the process. For decades, we have allowed clinical labs the freedom to make diagnostic tests. This bill will take away that power and give it to the FDA, and you can't get them done. When the pandemic first hit the United States, the FDA refused to let any COVID test be used without an emergency use authorization. And then the only test kit that they would issue was for the CDC. Monopolizing testing exacerbated the dilemma with the CDC test kit. It was unacceptable and had to be recalled. So for a while, there were no COVID tests in America, but it wasn't because they weren't available. In a lab at the University of Washington, a scientist named Alex Greninger, within days, developed an accurate test. He emailed an application for an EUA to the FDA on February 18th. This is when the CDC is still messing around. They don't have a test. Many of you here were complaining about what's wrong, how come the government's got it so screwed up. The FDA responded and told him that the electronic application wasn't good enough. He had to send it in paper by snail mail. Really? That's what the FDA told him. It had to come by snail mail. So he did. They said it had to include a copy burned on a CD. People don't have CDs anymore. Where are these people from? And a thumb drive. These people thought it was 2000, the year 2000 again. But he complied. From the University of Washington, this heroic researcher sent hard drives through overnight mail. 4 days passed before the FDA finally got back to him. We're in the middle of a pandemic. 4 days later, when they did, you think it would be to expedite his application? No. They wanted him to run his test against some other diseases like SARS, another coronavirus. Well, you might say, well, that doesn't sound too unreasonable. He said, okay, will you send me some SARS? And they said, no, we just can't give it out to anybody. He's one of the leading researchers in the field. They wouldn't send him. They said, we can't prove your test works unless you test it on SARS, but they wouldn't let him have any of the SARS to test it on. By the time Dr. Greninger could finally get a sample of the material he needed, the U.S. had its first confirmed COVID death in his own state of Washington. And wouldn't you know it, that very same day, the FDA decided to set aside and start letting individual labs test for COVID. We lost a month. This is the kind of red tape Congress should keep in mind when deciding how lab tests should be regulated. Everything about the COVID nightmare and the testing informs us we shouldn't do what's in the bill. What we're doing is monopolizing this in the FDA. It currently is dispersed to all of these clinical labs, thousands of them, that are significantly regulated and certified by the government and full of some of our best research in the country. We're going to say they can't make the test without authority from the central authority here who screwed it up during the pandemic. So we're expecting them to do a better job the next time, but we're taking away the freedom to innovate. Just a few weeks after Dr. Greninger went through all his rigmarole, I introduced this bill called the VITAL Act, which is included in this amendment. The VITAL Act clarifies that the law already is. CMS regulates lab-developed tests, not the FDA. It also calls for a public meeting where CMS will take recommendations for updating the regulations of clinical labs to meet the needs for modern technology. Lastly, the VITAL Act requires HHS to report to Congress about the availability and use of lab-developed tests during the COVID-19 response. I have a letter in support of this amendment signed by 30 pathology associations and academic labs, including the University of Washington, where Dr. Greninger works, as well as Penn State, the University of Vermont Health Network, pathology departments at Duke, UNC, East Carolina, Tulane, the University of Minnesota, the University of Pennsylvania, the University of Alabama, and many others. Bringing lab-developed tests under FDA will allow big drug companies to have monopolies on tests for diseases like cancer. It will also stop patients from getting access to better versions of the test. In 2011, a melanoma drug called vemurafenib, if that's accurate, was FDA approved along with a companion test. It turned out that the drug sold well, but the test didn't because it didn't work. Doctors opted to order lab-developed tests that were lab-developed in clinical labs by universities because they thought it worked better, because they saw it was missing patients, that the test that was approved by the FDA was missing patients with melanoma that would respond to the drug. FDA approval freezes tests in time, and eventually they become more and more outdated, less useful because they can't be easily improved. The lab-developed tests are changed constantly. If the lab finds that its results are not accurate and not working, they change it. They have no incentive not to continue to change and evolve and to adapt as the testing technology improves. I've practiced medicine for over 30 years, and I can tell you that when the doctors decide what lab to send a patient's test result to, they don't care if the test is FDA approved. They want to know if it works. Depending on the patient, there might be different factors to consider. They might need a test that can get results back quickly, or one that's very sensitive, or one that doesn't require the patient to undergo surgery again to get a new sample. I ask for your support on my amendment, and so we may prevent another debacle from the one we had created. This bill makes the situation worse. This bill takes what happened during the COVID pandemic and incorporates it into law and makes it permanent that all the clinical labs, every university in every one of your states that has these research scientists, that many of them are up for Nobel Prizes, will be limited because now they will be under the FDA, whereas they were before regulated under the Clinical Lab Acts. I urge a yes vote.
Thank you, Senator Paul. This is actually an area where Senator Burr and I are working on a bipartisan policy to try and improve the regulation of laboratory-developed tests. I really welcome members' input on that policy, which we are actually working to include in the FDA user-fee reauthorization package that we will do later this spring. I do think the user fees reauthorization package is a more appropriate vehicle for this, so I will be moving to table this amendment when we get to the votes. Any other comments on this?
Madam Chairman.
Senator Burke.
Madam Chairman, I intend to support your motion to table this. I agree with Senator Paul. We need more clarity to the regulatory architecture of diagnostic tests. This amendment would put regulation on diagnostic tests developed and performed in laboratories under CMS and leave diagnostic tests such as over-the-counter pregnancy at the FDA. Now, this is not the first time we've discussed this. I introduced a bill last year to create diagnostic test regulation framework at the FDA that would bring certainty to the regulatory process, keep FDA from over-regulating laboratories, and create a predictable risk-based pathway for diagnostic tests.